details. Let me now recognize Representative from New Mexico, Ms. Leger Fernandez. You're recognized for 5 minutes, Madam Chair.
Thank you, Chair Grijalva, and thank you to the witnesses for testifying today. The stories that you have told of the damage and the lingering effects of the weapons testing is heartbreaking. It is something that we are familiar with here in New Mexico in the sense that, as you all know, the initial atomic tests were made here in New Mexico, and we continue to suffer the consequences of the nuclear testing, to suffer the consequences of uranium mining and the winds that blow and blow those contaminants around. And indeed, you recognize the importance of the Radiation Exposure Compensation Act, or RECA, which is a model for what you're trying to do here today to try to provide some recompense for the victims and the people and residents of Vieques. I will be reintroducing RECA since it will be expiring in 2022. Ms. Pagan, the situation in Vieques is undoubtedly an environmental justice issue. Unfortunately, NOAA is often Hispano, tribal, and other minority communities that suffer the most from these kind of contamination sites. Could you explain a bit about, in addition to damaging the critical infrastructure, such as the local hospital, did Hurricane Maria also further spread existing contaminants, and how might that affect the number of Viequenses going forward?
Well, not being a medical person, but yes, being a resident and having 9 grandchildren on the island, the effects of the toxins after Maria, the period after Maria, were so evident, especially in respiratory diseases and the lack of electricity for almost a year on the island. The neglect on the part of the whole island of the Big Island and Vieques were so terribly devastated with Maria. So that attention to what was happening in Vieques was more on a back burner because there was so much tragedy on the Big Island, and as an underserved community and an isolated community which is facing at the moment the new hurricane season, and things have been happening so slowly as far as instating any kind of medical services for us. It's a very frightening prospect to consider what is going to happen to us in this hurricane season. However, there has been a reunification of forces and energies on the island to prepare ourselves with radio systems. And one of the major things, though, is that the medical services which we have now are being offered in what was the one refuge center. So if it strikes again, and it will, no refuge center or no medical services. The situation is critical, and the health of the people has not improved at all. As I say, every time you go by our cemetery, you know the number of people who are dying from illnesses that cannot be taken care of on our island. We need local medical service. We need dialysis. We need a maternity ward. because the suffering for a cancer patient is the same for a mother who is going into labor.
Thank you.
Trauma
Thank you so
is
much.
tremendous.
Thank you
And-
so much, Ms. Pagan, for sharing the urgent needs on the island with us. Chair Grijalva, my time has expired. I yield back.